Dr. Mohammad Jahanzeb with Florida Precision Oncology with 21st Century Oncology. This was an interesting case of a 61-year-old white male who had never really smoked and presented with a lump above his left clavicle and shortness of breath. And examination was really remarkable for some wheezing in the chest, and otherwise was fairly unremarkable. His laboratory data was also unremarkable. He had a biopsy of the left supraclavicular lymph node, which showed adenocarcinoma of the lung, and then he had an additional biopsy of the liver because CAT scan of chest, abdomen, and pelvis showed evidence of liver metastases. Interestingly, when molecular studies were sent, a patient had an ALK rearrangement. None of the other mutations were found. PD-L1 was 0. So to complete his staging workup, he had an MRI of the brain, which showed too numerous to count brain metastases. So when you think of this patient, what's a little unusual is his age is slightly above what we expect for ALK-positive patients. That's a little unusual feature. Otherwise, it's very common to have brain metastases. It's common to be metastatic at the onset, at the time of diagnosis. This is a fairly aggressive disease that has a predilection for brain. And in this case, we chose to give him alectinib, which is FDA approved for first-line use, besides some others that we can talk about later. And patient developed some toxicities on alectinib, specifically myalgias. Dose had to be reduced from 600 milligrams down to 450 a day, and that the toxicity was maintained at about grade 2 level. So ultimately, we had to follow him with imaging, and he progressed after 9 months.